I'm going to do a left hand. Right, so the first one we're going to do is a cut across the palm of the hand. So all we do is to get the rolled up dressing out of the packet, we put it on top of the cut. Now the problem with a deep cut there, if it's very deep, is there could be tendon damage coming off each of the fingers. So the one thing that we don't do is to force the fingers shut. So in this situation you'd ask your casualty, are you able to move your fingers? And you can.
Yes. So
you move your fingers and you squeeze it as tight as you can. So that's applying the pressure, but obviously Geeta's not going to be able to do that for very long because she will get cramp. So we help her. And in order to help her, I get a narrow bandage and I put it diagonally across the hand, coming from the thumb side, from here, because there's a curve. Don't come from the little finger side because it's a straight line. And all we do, we get the two lengths the same and we tie once underneath, we come back over the top and we tie twice. Now a lot of people get upset at these bits, but I don't. If you want to tuck them in, tuck them in. If you don't worry about it. Next thing that we have to do is to elevate the arm. So elevate goes across the chest and then we get another triangular bandage. And this is the normal sling for an elevated sling. So find the point, remember the rhyme, point to the joint, straight down the body. Before we start we just put a little knot in the point, and then that means I've made a little pocket for the elbow. So lay it on, point to the joint, straight down the body, pick the arm up, bring this round here, bring this over the shoulder and then tie at the back. And what we say about the tying is it doesn't need to be a reef knot, it just needs to be a knot, and we would always tie on clothes. And then just make sure that the hand's tucked in, and if I need to I can get a thumb just to test circulation. Remember when you're putting a bandage on that you'll be talking to your casualty all the time because you're checking for shock. Right, so that's the first one. Are we okay with that, Geeta?
Yes, we are.
Quite happy?
Very.
Right. So if we just do the second one on the other hand. So the second one is very similar, except this time we're going to do a cut down the hand. Right. Now I think it's always good practice to do a cut on both hands because you need to be able to put a triangular sling on. So this one is just straight across the hand. You get your bandage, put it straight across the hand, get the two lengths the same, tie once underneath, come back over the top and tie twice. So the rule is always tie once on one side and then twice on the other. Elevate the arm, exactly the same. Remember your rhyme. Point to the joint, straight down the body, put the knot on the elbow, pick the elbow up, bring this down, put the arm down, go round the back and then tie behind exactly like you did the first time. So this is an elevated sling again, and just have a practice at putting one on each arm, because you'll find that when you actually do it, one arm for some reason is always easier than the other.